Cancer Awareness Month. Every 2 minutes, a woman is diagnosed with breast cancer in the United States, which is why early detection and prevention is key. So joining me now is Dr. Lora Barke, a radiologist with Health One. Dr. Barke, we know mammograms are an important part of prevention. Really, what age should women start getting them, and how often should they do that?
Thank you so much for having me. Again, my name is Lora Barke, and I'm a breast imager. I'm the medical director at Invision Sally Jobe, and we are in partnership with Health One. So I'm so happy to talk to you about breast cancer screening. Every woman starting at 40 should begin screening annually. There may be some patients that may need to start earlier depending on their own history and their family history of breast cancer.
And how often should they be doing that?
They really should be doing it every year. And what we do know is that mammography saves lives. And even during times like this, we know it still saves lives.
Yeah, it's so important. For women who may not need a mammogram, what are some of the symptoms and signs they should be looking out for as well?
Yes, so it's really important to ensure that you know your own breasts. And if you do notice any changes, such as any redness, any lumps or bumps, even an area of very focal pain can be an indicator.
So really, if you notice anything that seems different or off, it's important to just make sure you get that checked out.
Absolutely.
Great. Well, we've heard, one of the common myths is that if you find a lump in your breast, it means you have breast cancer. Why is that not necessarily always the case?
That's a really good point. And we don't want people to be scared about finding a lump in their breast, because oftentimes breast lumps are related to cysts in the breast or fluid collections that can be normal findings and can fluctuate with your menstrual cycle or with hormones. You can also find other benign things in the breast that we find commonly. A very small percentage of patients may have a breast cancer associated with a lump, but really the only way for us to know is to look with imaging, and that would include a mammogram and an ultrasound.
Yeah, another reason why those screenings are just so important. We think of breast cancer as a disease affecting mainly women, but we know it also affects men. So how does it affect men?
Yeah, so about 1% of the breast cancer that we see is found in men. And oftentimes men will present with an area that they feel or a palpable lump. And, it really is the only way for us to know what's going on is, again, with imaging. And so just like women, we will start with a mammogram in men and then also look with ultrasound. There are many of benign diseases that happen in men too. But again, we don't want to miss anything. We want to make sure that if there is something going on, that we find it sooner than later.
Great. And with it being Breast Cancer Awareness Month, is there anything else we haven't touched on that you want people to be thinking about or aware of?
Yes, Breast Cancer Awareness Month is a great reminder that if you haven't had a mammogram in the last year, that it is time to come in. We know that delaying mammograms can lead to finding breast cancers that may be more advanced and less treatable. So we always promote the fact that it's better to find it sooner than later. And with early detection, there's so much we can do. The other thing is that we may not know what your breast composition is. So what is your breast density? There are other tools that we can use along with the mammogram, such as a screening breast ultrasound in patients who have dense breasts. And every time you come in for a mammogram, you'll get an answer in terms of what your density is, and if maybe another tool like that could be helpful. In addition, as I mentioned earlier, you may need to start screening sooner than age 40, or even if you start at age 40, we determine what your risk of breast cancer is. And if you have an elevated risk of breast cancer over a 20% mark, then we might recommend that you start also doing MRIs. And MRIs are a very sensitive tool, and we use that along with mammography to help us in early detection.
Yeah, we know it's so important. Breast cancer impacts so many different people, really here in Colorado and just across the nation, so very important.
Yes.
Thank you so much, Dr. Barke, for all of that helpful information, and we'll be right back.